hello to anyone who's out there. And I'll just say, hi, I'm Beck McQueen from Birth Sense Australia. And I'm so happy to have you along for what I hope will be a really valuable half an hour for either you or someone in your life that you know and love. Today, the topic of our discussion is labour signs and labour progression. Here's what you need to know. So joining us today is Sam Turner. Hi, Sam. Sam is a registered nurse, sexual health practitioner, registered midwife, and has a graduate diploma in education, her master's in management, as well as her master's in maternal and child health. So Sam, welcome, and thank you so much for being here today and offering your valuable time and expertise. Let's share some great information about labour and birth and answer some of the questions I've been sent in from expectant parents as we go along too. So let's dive in, shall we? Sam, can I ask, what are the 3 things that you as an experienced midwife wished parents knew about labour and birth before having their baby?
Okay, thanks, Beck. Yes, that's a good question. The 3 things. I think probably the first thing that's the most important is that labour isn't as painful as you think, if it's delivered to you naturally and normally, the way nature intended it. And that isn't the case for some people because they need to be induced or they need to have an augmented labour. But for most of us, if labour is delivered to you the way nature intended it, naturally and normally, you'll only ever have about 3 contractions every 10 minutes. Now, what you might call, not worst case scenario, but the biggest case scenario, close to the birth of the baby, the last 2 hours of your labour, you're really looking at 3 contractions every 10 minutes. The pain, surge or tightening of which, whatever you want to call it, won't last longer than about 60 seconds. So if my maths is good, that's 3 minutes of pain, a surge or an intensity, and 7 minutes of absolutely nothing. So in every 10-minute block, you have 7 minutes of nothing going on, pain-free, surge-free, intensity-free, and only 3 minutes of something going on, which are those contractions to help you birth the baby. So there's a lot more of nothing than there is something. And thus, labour isn't as painful as things like breaking an arm or a leg where you've got continuous pain. It's intermittent pain. It's more endurable and it's not as bad as you think. And I can tell you that with my hand on my heart, having been at the coalface and helped hundreds and hundreds of women birth their babies, that is the reality of it. So it's not as bad as you think. It's not as painful as you think if it comes to you naturally the way nature intended it. And that's the story and that's your journey. So that's the first thing that I would like to tell you. The next thing that I would like to tell you is that labour is really only half a physical process and it is actually half a mental or emotional process. It's very hormonally driven. So animals all through history have always been able to control their labours, and Homo sapiens, humans like us, we're not any different. If we get fearful, if we get scared or nervous or anxious and we get high levels of adrenaline, adrenaline is the opposite hormone to oxytocin. So Mr. and Mrs. Oxytocin don't like Mr. and Mrs. Adrenaline. More adrenaline, less oxytocin, less labour. Less adrenaline, less fear, anxiety or worry, more oxytocin, more labour. So the moral of that story is that you need to stay as calm as you possibly can. Panic never helped anybody anyway. Stay in an environment where you feel supported. If you're more scared or nervous at home, go to the hospital and be with the midwives or be with your birth attendant or your birth support or get your birth carer people in whatever environment you're birthing in there. But try to stay as calm as you can and think about finding, sourcing or seeking out calming therapies that can help you stay as calm and relaxed as you possibly can in labour. It'll help it progress better and it won't be as long. And if it's not as long and it's not as stressful, you will then recognise it and talk about it later on as being less painful and less traumatic or less difficult. That's 2. And the third one would be males and partners, dads or support people. Feel free to ask to join in, participate. It's fundamentally a natural process. It doesn't have to be a sterile technique. You can put gloves on and help birth the baby yourself. In all my years of being involved in teaching childbirth education and working with mums and dads, I've always found, and partners, I've always found that partners and dads are very fearful about attending the process. And it's very fearful if you see, and it's not necessarily very attractive, I understand that, to watch other women having babies that aren't you or not your partner. And that can create for a lot of fear too. However, I find that almost all of the time, the partner or support person that attends the birth said it was the best thing they've ever done. It was very worthwhile. and that they felt okay. As midwives, our job is to not just care for the mother, it's to care for the father or support person or partner and the baby as well. So you're not in there alone and you're not in there unsupported. You're in there being looked after by the midwife just as much as the woman in labour. So join in, ask to participate, get involved, be brave, and don't worry, because we're there to support you just as much as your partner having the baby. So they're the three things.
I love it. So you're saying, number one, labour is not a continuous timeline and painful experience. It's periods of work, periods of rest, and in actual fact, there will be times where you'll be almost bored because there's not that much going on. Two, learn how to keep calm, get some skills to keep yourself as calm as you can. And three, dads get involved. I love it. And all of those things, most good childbirth education classes will give you skills and tools around that. Is that your experience of seeking out more education if possible?
Yes, yep, definitely seek out education as regards childbirth. If you're educated and you're empowered, you're definitely going to be calmer. And that's been proven through research time and time again, that it is better to be informed. It is better to know. It is better to be educated, even if the information that is going to be delivered to you you're a bit fearful of. You are better off to know what's in front of you, to know what you have to face, to know what you have to deal with, to know what it involves, because inadvertently that will decrease some of the fear. So you should seek out, and those self-help, self-seeking behaviours, seek out education and support and information before you go and do something, which is one of the biggest events in your life, birth your baby.
And do you think that, well, a lot of people will say things like, oh, you know, I'm just going to go with it. I'm just going to wing it and see how it goes. What's your personal experience around that paradigm?
I think some people think that that would be the relaxed process, that if they stay like that, it would help them potentially stay calm. And that they won't have to expose themselves to some of what they might consider the more graphic nature of birthing, and it might make them less fearful, but it inadvertently has the opposite effect. You go in ill-informed, you go in ill-prepared, and therefore your adrenaline's higher. If your adrenaline's higher, your oxytocin hormone's lower, your adrenaline's higher, you potentially elongate your labour, you make it longer, it can go slower, and therefore it can end up on the cascade of pathways of intervention and ending up, you know, going from labours and perhaps needing things like caesarean sections that may not have been needed if you had have been well prepared, had some relaxation techniques up your sleeve, understood what was happening to your body, understood the timeline, so that you weren't as fearful.
Yeah. That's such good advice, and it makes so much sense. I think that understanding is probably 80% of the journey, or just understanding what those feelings are that you're having, how to work with them, and that's so empowering to know that for mums and for partners. So why is it, Sam, that often women will be told by midwives or in childbirth ed classes to stay at home as long as they can in early labour?
Okay, so there's two parts to this. If you're having your baby at the hospital, and that's where you plan to birth, if it's your first baby, yes, it's a good idea to stay home in an environment where, and if you feel more relaxed, more comfortable, and it's more familiar. If you don't feel more relaxed and more comfortable in your home environment for whatever reason, it's not a supportive environment, or you don't feel safe there, or you feel like you've developed a great relationship with your care practitioners and you would feel calm and more relaxed with them, then my advice is that you go and you seek the environment where you feel you're most calmest and relaxed, and that might actually be at hospital. But with the first baby, you do have the luxury of time. You have the luxury of time because your cervix has to efface and has to flatten out like a pancake first before it pretty much starts to dilate and the hole starts to open up. Now, this usually takes on average about 4 to 6 hours. It will work better if you're calmer. So the calmest, most relaxing environment for you is the best place for you to be. Now, with second and subsequent babies, this story's off the table because you might only have 15, 20 contractions, hardly any, and the baby can be born. Because when you go into labour with a second and subsequent baby, the cervix starts to dilate pretty much straight away. The hole pretty much starts to open up, so to speak, and the baby can come at any time. So there's a famous midwife saying, keep your gloves in your pockets for a multi, because you don't know how fast the baby will come. So the staying at home is a first baby story, really. Second and subsequent babies, it's best just to go to where you intend to birth the baby as soon as you think you are in labour. And with the first baby, yes, you can stay at home. And you can stay at home until you basically do one of two things. You're having 2 to 3 contractions every 10 minutes, tightenings or surges, 2 to 3 every 10 minutes. The pain, surge or intensity of which is lasting 45 seconds or longer, and you've been doing that for at least 1 hour, come on down. You usually around about 3 centimetres dilated at that stage, and you've got to get to 10 to be fully dilated. The Hollywood version of that, or another version of that, if you're not somebody that likes statistics, is when you can no longer walk with the contraction or talk with the contraction, gravity's taking a hold and you feel you need to lean on something for additional support while you're having that contraction, you're usually about 3 centimetres as well. Come on down. If it's a second and subsequent baby, I just want to highlight, and you go into labour, go to where you think you're going to have the baby straight away.
Yeah, don't sit on that story and hang your head on that story of staying at home as long as you can. Got it. Good advice. Well, with regards to labour, what are some of the common signs of labour? But then what are some of the lesser common signs as well? So it's a two things in that question, the most common signs and signs that are indicative of labour but maybe people don't know about as much.
I think as far as labour, women going into labour, in Western society, and having worked all over the world and with many, many different cultures, in Western society, we seem to have just, perhaps we don't interpret as easily or as quickly or as readily signs of being in early labour or when our baby's coming. When I work with other women from many other cultures, they can often tell me, you know, oh, Sam, my baby's going to come in the next 3 or 4 days. And that's just about the way we're taught and about the way we're educated and the wise women stories that have been handed on. And also it's an intuitive thing or a bit of an instinctive thing. And I think we've erred a little bit away from trusting our instincts. So some of the things that I can tell you are this. A mucus plug, especially if you're a first-time mum, it'll usually come away in small amounts. And if it's a second and subsequent baby, sometimes that mucus plug can come away in a bigger amount. Now that mucus plug is sitting in your cervix. Unless your cervix starts to ripen, unless it starts to soften, that mucus plug can't and won't come away usually. So signs that you are coming into early labour or labour is going to start in the next, 1, 2, 3 days up to a week, maybe a little bit longer, is that mucus plug starts to fall out of the cervix. It starts to come away. Now what it looks like is, they call it a bloody show, but that doesn't really do it justice, because what it looks like is if you take an egg out of the fridge and you crack it on your hand, you throw away the eggshell, you throw away the yellow yolk, what are you left with? Clear jello. Now, sometimes in that clear jello, you'll find spots of blood, like an unfertilised chicken egg, and mucus from a mucous membrane. So that would be some green stringy mucus, like mucus from a mucous membrane. That is also like what you would see with ovulation mucus. So seeing that plug start to come away means your cervix is ripening. Your body is getting prepared for labour. Don't get on a plane. Don't take a holiday. You can't at the moment anyway. Don't go anywhere because labour, it looks like it's probably going to imminently start in the next 2, 3, 4 days, up to a week, usually tops. The next thing is cramping. Now, the cramping is very unique in labour. It's not like cramping you get if you go to the gym or cramping from a muscle. It's from peripheral shunting. So what happens is the uterus starts to get a bit active and the body will shunt blood away from the peripheries, the arms and the legs, and it will send it to the vital organs. Now, in doing this, it's like pins and needles or like a bit of frostbite. So you start to feel pins and needles over surface areas of skin. It'll draw it away from the skin as well. So you tend to get colder hands and colder feet in labour, which is really interesting because, and when you're in early labour, it can be a really warm day or a warm room. But you also tend to get pins and needles and a cramping feeling over large areas. If the baby, I've got a baby here, if the baby is in an anterior lie, you'll feel more of that. So sitting with its back to your tummy, you'll feel more of that cramping in your skin over your stomach and maybe the fronts of your thighs. If the baby's in a posterior lie, so its back's to your back, you'll feel more of that cramping over your back and the buttocks of your cheeks and down the backs of your legs. And it feels more like pins and needles or a little bit of frostbite. So it's a very weird, unique sort of skin cramping. So keep an eye out for that. Bowels can get looser leading up to labour. I find on the whole they get looser in younger women and they may not necessarily get looser in older women, but that can be a sign that you are getting closer to, and your uterus is getting a bit more active and closer to coming into labour. And you obviously would start to then get contractions, tightenings or surges. Now these contractions, tightening and surges are something that increase in force, strength and duration. They build and build and build. They get bigger, they last longer, they feel stronger. They're not Braxton Hicks's. Braxton Hicks contractions are something that happen to some women, not all. We don't really know why. It's a bit of a phenomena. The wise women of our culture, our traditional tribal Western elders, they will tell you that the grandma's law that you're paying off the lay-by, but I haven't actually seen that work in practice. And they are just tightenings. They're like the uterus having a bit of an exercise. Now, you can control Braxton Hicks contractions. They're controllable, which is very different to labour. Lay down for 20 minutes, relax, read a book, make sure you don't lie flat on your back because you don't want the baby on your femoral arteries. That's not good for blood flow, so your head's got to be slightly elevated, but just have a rest, and usually those Braxton Hicks contractions will stop. True labour, you lay down, you have a rest, and it just keeps going. They keep increasing in strength, in force, and in duration, and you keep getting more of them. So they last longer, get stronger, and you get more of them. That will tell you that you're in labour and that labour's kicking off and continuing. Less common signs, the psychological state of labour, which is very underplayed, and I go back to talking about this intuition or this instinctive property that we haven't all lost. We do still have it. It's stronger in other cultures, and they can put words and language around it better than we can. For us, I would say it's a bit like an anxiety state. It's the nest egging syndrome. It's an anxiety state, and it's where you just start to have this anxious feeling that something big's about to happen, that something great's about to happen, and suddenly you can feel like my house just isn't in order, and the bills aren't paid, and climax has been quite a dramatic feeling of intensity and anxiety, and it really just means that the baby's coming. It's a build-up and a climax of what's called the nest egging syndrome. Tiredness or surges of energy can go one way or the other coming into labour, and the calm before the storm. Often babies will go quiet 2 or 3 or 4 days before they're going to be born. Now, when I say quiet, you need to get a minimum of 10 fetal movements in 24 hours. So, and if you're not getting them or you're worried, you can scull an ice cold glass of water, or you can just simply give your baby, a bit of a wobble, a bit of a shake, and see if it will kick back. So you want a minimum of 10, but this baby might have been a lot more active than that, and suddenly it goes a bit quieter. It was having 50 movements a day, and suddenly now it's only 20. So you can get a bit of a calm before the storm, a bit of a rest, and that can let you know that in 1, 2, 3 days tops, the baby is coming. And finally, water's breaking. Now, only in about 10 to 14% of women do the baby waters break prior to coming into labour. So it's quite uncommon. Usually that triggers labour to start within 24 hours if that happens. If that doesn't happen, then you've got 24 hours, which is considered best practice to make sure that you don't get an infection in the uterus, to get to hospital and get that induced. And if you think your baby, or get an induction going and get the labour started, if you think your baby waters have broken, you need to call your care provider. So they're the main things I want to talk about.
A lot of information there. You said something in there that I know when a lot of parents are surprised by that midwives have a definition of true labour versus just sort of faffing around. Can you explain that a little bit more, what a true labour is?
So a lot of women will say, which is really interesting, oh, I was in labour for 3 days, or I was in labour for 4 days, or hours and hours and hours. And certainly you could have been having contractions and tightenings, but actually what's recorded, what will be on your birth summaries and what will be in the paperwork from the hospital, is that your labour commenced once it became true or established labour, or active labour they call it. Now, active labour usually starts when you're about 3 centimetres dilated. The reason for that is prior to then, the contractions that you were having, they're irregular. They're not coming at the same times. They're coming for different lengths of time. You might have a 7-second contraction, then you might have a 20-second contraction 5 minutes later, then you might have nothing for 10 minutes. So they're chaotic, they're all over the place. There's no rhythm and they're not regular. And so they're early labour. They're called early labour. It's very easy to knock those on the head if you get a bit fearful, or you get a bit scared, or you have an adrenaline surge. Sometimes they'll stop and you'll go into what they call a false labour, or you might have to wait a few days to come back into labour. So early labour is very erratic, irregular contractions and tightenings. They last irregular lengths of time, and it's easy to knock them on the head and that labour stop. So we don't count that statistically in the records as true labour. True labour is when you're having regular contractions lasting regular lengths of time, and again 2 to 3 every 10 minutes, the pain of which is lasting 45 seconds or longer, or you can no longer walk or talk through the contractions when you're having it. You're usually at about 3 centimetres, and you've usually started true labour from then. Prior to that, It's not that counted because it could easily fizzle out or stop. Okay. Yep.
So seeing we're on this, it's probably a good idea, I think, to talk about the stages of labour. Go ahead and tell us, or you can tell us in this short time, about what are the stages of labour.
Okay. So it's good to know the stages of labour just so you know what's happening with your body, but it's not something that you need to really, I don't think, remember and feel fearful about if you get into birth and you think, God, what stage am I in? But it's just good to understand what's happening overall. We just, for Western medical terms, categorise labour into three things. One is labour, is stage 1. Now, stage 1 consists of early labour, which is 0 to 3 centimetres dilated, so a facing of the cervix and dilating up to 3 centimetres. And for a first-time mum, that effacing of that cervix alone can take about 4 to 6 hours. And then we say roughly, as a rough rule of thumb, that your cervix will dilate 1 centimetre to 1.5 centimetres an hour, roughly. Sometimes it goes a bit faster, sometimes it goes a bit slower. So early labour has the effacing of your cervix and dilating up to 3 centimetres. This is stage 1. Stage 1 also has, after early labour, active labour. This is where you dilate from 3 centimetres to 7 centimetres, and this is where you've established labour. This is where the paperwork says your labour starts from, and this is where your contractions will come in patterns, and they'll come at regular times, and they'll keep increasing in force, strength and duration. And then you will go into transition from 7 centimetres to 10 centimetres. Now, this is the part that most women find difficult. This is where the going gets tough and the tough gets going. This can be very emotional. The intensity and the strength of those contractions gets pretty full on. You're usually having 3 every 10 seconds, and they can last 45 to 50, 60 seconds. And that's quite an intense part of labour. It's about 2 to 3 hours long usually. And that's really what I call the tough part of labour, where you know, you need a lot of support and you need a lot of, hopefully, pre-education so you can bring some of your self-help techniques in. The second stage of labour is the birth of the baby. That can take up to 2 to 3 hours or shorter with a bit of luck. And the third stage of labour is the delivery and the birth of the placenta. And that can take up to 2 hours naturally, but very often now in Western healthcare practices, they give you an injection in your thyroid hormone, and that placenta's coming away, you know, somewhere between 10 to 20 minutes later, a bit of extra oxytocin. The reason they do that is it decreases your blood loss, and once the placenta's out, the contractions completely end, they stop, and so labour's finished. And so a lot of women do opt for that.
So with regards to the emotional side of labour, because as you said earlier, it's not just a physical event, it's an emotional one and a mental one. What are some of the emotional hallmarks of the different parts of labour?
I think early labour, I think women are surprised that it's not really that much worse than their worst period pain day. And that takes you all the way up to 3 centimetres. So a third of that labour potentially is over, and you've been able to endure it. You might only be having a contraction every 7 minutes or 15 minutes, or, you know, and they're quite short. So emotionally, you're thinking, oh, I can probably do this. It's not going to be as bad as I thought. Stay calm. This is going to be okay. Then you go into active labour, and as long as you've got good supports around you and maybe some pain relief or some therapies or some massage, or you're doing hypnobirthing or whatever process you're using, mindfulness, whatever you're using, you will find that women tend to, on the whole, still stay reasonably confident. They're still quite right-minded and still in the relaxation stages. They're still laughing, or they might be talking on the phone, or they might be talking to their partner, or they might be, you know, drinking some water, or, you know, eating, or whatever it is that they're allowed to do in the system that they're in. And they're still feeling pretty positive. And then transition hits. And transition is the tough part of it. That's the climb Mount Everest bit. And this is fraught with a lot of emotion. And the reason for that is they call them crisis of confidence moments. It's when your endurance and your strength is tested, and that can create for a bit of fear and a bit of anxiety, and it can create some subconscious, you know, reflections of that. So we see people might moan, or people might cry out, or people might develop some rhythms and some rituals that you tend to find to come from the subconscious in birth. They might pace, or they might, you know, pat their legs, slap their legs with their fists, or want to squeeze, or they want to rock, or they want to do some of those guttural type sounds that you hear often when people do yoga. And some interesting subconsciously driven pain control techniques come forward. And this often surprises the partner, and it can look very emotional, and it can be very different to what they expected to see, and they can start to be a bit fearful and think, what's happening with my partner? They're losing control. But in fact, a lot of these things aren't losing control, particularly if they're repetitive. They're often the rhythms and the rituals and the subconscious play out that women find deep within that just come out when they're in labour. And as midwives, we're trained to recognise them, explain them, support the support person through working with them, and often help the woman work with them. So we might say things like, that's it, keep rocking, you're doing really well, just hang in there, keep rocking, that's it, squeeze those hands, you're doing really well, that's it, moan it out, whatever we see the rhythm and ritual is. If we think that they've found a self-help technique, a subconscious one, and it's working and it's playing out constantly, we'll encourage it. So that's where everybody really focuses on that emotional side of labour, and where women are really expressive and it looks really different and can look a bit confronting and can be a bit scary, and they look like they're losing it, or in fact sometimes they're not. They've just developed their own subconscious rhythm or ritual or coping strategy. The birth of the baby obviously is pretty tricky, and that can come with a little bit of yodeling, should we say, and that's absolutely fine, because that can be a diversional distraction in itself, and certainly I did that with some of mine too, and that's absolutely fine. There's nothing wrong with verbalising what's going on with your life. And then once the baby's out, the contractions usually drop down to about half mast. They're only half as strong, and so really you're feeling coping like quite well, and you're really excited and you're overjoyed, and you've had a surge of hormones, and you've seen your beautiful baby, and your whole face lights up, and you've just got to get that placenta out, and you're back to calm, sort of what would be considered, I suppose, really rational, sensible responses to everything. But the whole process is absolutely beautiful. There's really no crazy in it at all. It's just something that looks it can look emotionally very different, and you might see your partner express themselves in ways you've never seen them express themselves before, and it doesn't mean that it's going wrong or it's pear-shaped or they've lost control or this is out of control. Sometimes it's actually a subconscious process of being in control. Yeah.
That's such great information for birth partners to know. What do you think great birth partners do for women?
I think most birth partners, especially if it's the first baby, walk in there a bit sheepishly and think, I hope I can be supportive. I really don't know what to do, and I hope I go okay. I think the very best thing that a birth partner can do is be directed by the woman, because even yourself in your lifetime, if you're in pain, whether it's from birthing or not, it's very hard to express yourself. It's very clipped. So you might be in a lot of pain. You might be like, oh, massage, I want to stop. I want to start again. Oh, go in. Oh, stop. And the poor old partner's sitting there going, do I start? Do I stop? What does she doesn't know what she wants me to do. And it's not a good time in the middle of a contraction to stop her and say, do you want me to massage up now? Do you want me to massage down? What do you want me to do? Be led by the woman. The more intense it gets, the more clipped the conversation, the less she's going to tell you, and the more direct and specific it's going to be. And just follow the instructions and the orders, because that's what we do as midwives to a large degree. So you just follow your orders and you'll be absolutely fine. But better still than that, it's the midwife's job to help support, if you birth with a midwife, to help support yourself and your partner when they're in labour. And so the support people are very supported. Would you like to get her a drink? Do you think maybe she needs some more water? Would you like to massage here? Look, I'll show you how it's done. Are you feeling okay? Do you need anything too? Do you want to hop on the bed and give her a hug? It's really nice to tell her, wonderful words of encouragement. Did you practice any of that in your childbirth ed? What did you say? Do you want to say it now? It's our job to support the support people as much as the woman in labour. So don't be fearful about being a support person, because we've got your back.
I love that. The role of the support person cannot be understated. It's such an important job. Yet often there's not heaps of pre-learning and education that goes around the role of the birth partner, and many people just front up thinking, well, I'll be okay, I'll work it out on the day. But it can be quite confronting. So again, I'm a bit one-eyed and believe wholeheartedly in education for both parents. But yeah, what you're saying is so true. So with regards to anything else in labour and birth, there's one thing that I've been asked by one of the women who's written a question. She wants to know about the importance of after baby's born and skin to skin.
Skin to skin. Skin to skin is critical, and actually Australia can really pat themselves on the back for doing a lot of this research in kangaroo care. We're one of the pioneers of it for information for the rest of the world, so bravo, good on us. And what we found was that you can thermoregulate a baby, so get them to the right temperature very quickly by putting them on your skin. And the reason for that is that the hotter human, doesn't matter if you're a big person or a little person, the hotter human will irradiate, eject into, put heat into the colder person or the colder baby. So if you get a baby that's naked and wet and potentially can get cold, and you put it on your skin, you can put in at least, half a degree, if not more, to help thermoregulate and warm that baby. A baby that's warmed quickly and thermoregulated quickly at birth has usually good blood sugar levels, because if they're cold and they shiver, they start to burn up their energy and their calories, and you don't want that. So they'll have usually good blood sugars. They'll feel warm, they'll feel comforted, they'll feel relaxed, they'll be thermoregulated. And there's a pheromonal response, like a shifting of a sensory thing that triggers hormones both in the baby and in the mother. And so it helps us release hormones that help us make things like breast milk, that help our placenta come away, especially if they're suckling at the breast as well. And so it's important for that. And also seeding is something that we talk about now. There's a biomes, or there's a natural bacteria that we have on our skin, and we need to transmit this and give the baby coverage for it, because it's protective ongoing against, bacteria and infections and all sorts of things that can happen later on. So there's a whole lot of reasons why skin to skin's really important. And so I'll just highlight again the establishment of breast milk, thermoregulating the baby, keeping the baby's blood sugars correct, and creating the hormonal releases that you need for things like your breast milk and the things that the baby needs, to kick into its system, as well as the microscopic world and the biome world of making sure that they've got the right bacterial content, the good bacteria.
Amazing. And yes, that is a relatively new thing that's come out, isn't it? The evidence for that fourth stage. There is some footage around I've seen, and I've shown in some of our classes, of babies independently crawling to the breast and self-attaching. Have you seen that in your practice?
We really, I suppose, working in the hospital setting, in a clinical setting, the baby is usually lifted up and placed on the mum's tummy. The breast crawl can take an awfully long time. It can take hours, and you've got a very fractious baby, and then you would run the risk in a setting like that of the baby getting a low sugar and burning up way too much energy, and you could be a little bit of a pickle there. But definitely they're born with that instinct. Definitely they can breast crawl. Definitely they can bop their heads around and search for the breast, and that rooting reflex kicks in. But most of the time we lift them up and place them on the mum's tummy and make sure that they're covered so there's no breezes or drafts, and they're warm that way. But yes, the breast crawl is a very real thing. But to see it go from a birth, that for a baby to actually crawl, over an abdomen and all the way to the breasts, you're talking about hours. So you don't actually see that in clinical practice, but you do see a baby up there on the tummy bopping around and searching for a breast. So yes, but I've only ever seen videos of babies crawling. Yeah. Pretty dramatic way to find your mother when you're already this big. But yes, they can do it. They're amazing. Yeah.
It shows just how strong some of those instinctual reflexes are in babies and other mammals too. But just one more thing before we sign off, because we're nearly half an hour, or just over half an hour. Can you briefly explain to us what the cascade of intervention means?
The cascade of intervention. Okay, so the theory, the westernised theory about the cascade of intervention is that it's based on how well your labour is progressing. If your labour is not progressing well, irrespective of what the cause of that is, it's likely that you're going to then need interventions to support you to birth the baby, because once you're in labour, especially established labour and committed to it, one way or the other, the baby needs to be born. There's no going back. You can't just stop and go home once you've been in active labour. That baby has already been through a certain amount of duress and stress, and the uterus has done a certain amount of work, and you need inevitably for that baby to be born one way or the other, or it could be adverse outcomes, which you don't want. So the interventions that would come, the cascade of interventions, one of the things, I suppose, in a more naturalistic framework or a more naturalistic sense, is that if you have a lot of fear and you have a lot of anxiety and you have a lot of tension, you can be secreting a lot of adrenaline, and therefore knocking your natural oxytocin off, making your labour longer, slowing down its progress, and setting yourself up potentially for needing interventions like, forceps, vacuum extractions, Caesars. Also too, the cascade of intervention can be very strong if you have to use a lot of muscle relaxant type properties. Now, muscle relaxant drugs pethidine and morphine can sometimes, you see them work both ways. In good established labour, they could actually relax the woman, calm her down a bit. She doesn't secrete as much adrenaline, and I've actually seen them used and labour pick up and improve. In very early labour, high-dosed drugs that have relaxant properties, like pethidine, morphine and epidurals, because they do relax the muscles, if they're used too early on, sometimes they can knock labour on the head. And if you are in hospital and you have an epidural put in, it's a very big support or intervention. It costs a lot of money. It takes a lot of skill to put it there. It's quite unlikely they're going to take the epidural out if your labour fizzles out and say go home, if it relaxed it so much that it sort of stopped or went down. So therefore you would have to have an induction, perhaps some hormones put up, run through a drip to try and increase labour. Also with epidurals, they talk about the cascade of intervention, because about half of all women that have epidurals will need an assisted delivery, either a vacuum extraction or forceps, because you can't push very well. Some of your muscles are you're unable to use your accessory muscles. You can certainly try pushing, but you're usually unable to use a lot of your accessory muscles, and so it's likely that you'll need forceps or a vacuum extraction. And that's what they trigger as the cascade of intervention. It can be from high usage of, or high dose usage of, or usage of muscle relaxant drugs, anaesthetic drugs, and it can be from self-induced, from too much fear, not enough birth preparation, not enough education, and far too much adrenaline, and just slowing the whole thing down. You can't stay in labour forever. You get maternal exhaustion and you get baby exhaustion. And so then you can end up needing things like a Caesar because the baby gets distressed, or the mother's labour fails to progress, or, you know, there's two phrases for that. It can be failure to progress, or in another model it's called the fear, tension, pain cycle, but both end up with the same outcome, and they can be, you know, intervention.
So just would there be one thing that you could sort of leave us with, and a bit of advice for anyone who's sitting there at home now, who's maybe watching this on Facebook, they're going to have their baby, they're probably sitting there, particularly if they can't get to a class with COVID-19 now, that's going to cause some people to be feeling more anxious than normal. What would you suggest that those people at home do right now at this point in time?
All right, I think the first thing, as a woman and as somebody that's been a midwife for a long time and worked with birthing women all around the world for most of my 30 years, you have to have a reasonably high self-efficacy, ladies. You've got to believe in yourself, and you've got to trust in yourself, and you've got to trust in your body. We are well-oiled machines. We are very, very good at having babies, and we are pretty design perfect on the whole. You don't wake up in the morning and go, is my heart going to beat? Are my lungs going to breathe? Is my brain going to tick over? I do, and then have a coffee, and it's okay. But you don't usually wake up in the morning and question any other organ in your body. You don't need to wake up in the morning and question uterus, because the vast majority of the time it works beautifully, and you will end up with a lovely, healthy baby at the end and do a fantastic job. So believe in yourself. Having babies is a natural process on the whole. It's not, you know, necessarily a surgical procedure. That's usually only if, you know, it can't be done vaginally, or it's a repeat Caesar, or there's a reason for it. So trust, have faith, and believe in your body. Above all, even if you haven't educated yourself well, you don't have anything up your sleeve as far as relaxation therapies or calming yourself down therapies, try as hard as you can to stay calm. Just relax and stay calm. If you're calmer at home and it's your first baby, fine, until you reach the things that I talked about earlier on. But if you're more nervous or more anxious, go to where your healthcare provider is, or wherever you can stay the calmest and be the most supported that you can possibly be, because that is really critical in the hormones that make labour progress for you to get an end result. So staying calm will make your labour usually go faster and be more expedient. So that's the next thing that I wanted to say. And the other thing is educate yourself. You know, you've got Birth Sense here with Rebecca, online childbirth education. You know, get yourself empowered and be educated so that you can take control of yourself and your body. And when you take control of yourself and your body, you know what's going on and you feel educated, it's a lot easier to stay calmer because you feel empowered, and empowered women are calmer women. And better to make better choices because you've got more knowledge about what those choices are. Yeah. That's my advice.
I think it's excellent advice.
When in doubt, bring your healthcare provider. You know, in the private system, you pay a lot of money. Ring up and ask for help, ask for support. In the public sector as well, you can always ring the hospital and you can always be put through to the midwifery unit, and you can always ask a midwife. It's no problem, any time of the day or night, at any of the hospitals you're birthing at and to any of your healthcare providers. You're not alone, you're not socially isolated. There's telephones, and just get on them and make the call.
I love it. I love it. Only a phone call away. And that's true for when it's even not COVID times. You can always ring when you're in labour. You can ring, bouncing around with that midwife or that healthcare provider. And that's something too that I think gives people a lot of confidence to know that they can just troubleshoot over the phone. So that's fantastic, Sam. Thank you. Thank you so much for today. And what you shared with us is just such practical, great information for parents who are expecting a baby. And thank you for your time and your openness and generosity of spirit for agreeing to come along today.
My absolute pleasure, and my very best wishes to every woman that's pregnant and going to have a baby. It is a beautiful experience. It'll be one of the best things you ever do in your life. And just stay strong and stay calm, stay relaxed. Get yourself empowered, get yourself educated, and I wish you the very, very, very best of luck. And I'm very jealous because babies are so beautiful and all mine have grown up. Thanks, Rebecca.
Thanks, Sam. And so good you get to cuddle them every day in your job as a maternal child.
Well, I was cuddling them every day until COVID-19, but life will come back to normal, thank goodness, and I will get my baby therapies again.
No, so true. Thank you so much. And just one thing I wanted to say to anyone who's at home now and you're thinking, well, what resources are available to me? We do have some really great government resources. The Pregnancy, Birth and Baby Line, where is a resource that's there for everyone, and you can pick up that phone, have those conversations with a midwife or a maternal child health nurse. So that's really great. You've also got some websites that are government approved, like the Raising Children website, and also we've got for breastfeeding, the Australian Breastfeeding Association. So there are lots of resources that are out there that maybe people don't know about. As soon as we hear about them, we pop them on our handy contacts page on the Birth Sense Australia website. And also too, there's some fabulous mental health supports, men's health lines. So we really are such a lucky country in that we have these amazing resources. It's just a matter of knowing where they are, what they are, and how to find them. So head to the handy contacts page there. As Sam mentioned, one of the things that Birth Sense Australia is doing in this time when people are cut off from accessing their normal antenatal hospital classes is that we're offering our online program on a contribute what you can basis, so no one misses out on getting some antenatal education. And we're also running these regular webinars with fantastic health professionals like Sam, and we've got lots of other people who we've done some interviews with. Head to the Birth Sense Australia YouTube channel, and you can also get some evidence-based information from really respected healthcare professionals there too, as we build that library up for you to access solid information. So I'm going to say thank you, Sam, once again, and I just hope that what we've shared today makes the world a little bit better for an expectant parent who's looking for some solid information. So take care of you. Bye, everyone.
Bye. See you. Big virtual hug. Bye.